Hi, I'm Tom Lowry, Director of Worldwide Health. Welcome to the Just-in-Time series for Health Analytics. At Microsoft, we're pioneering new paradigms for health analytics, things like research on demand, real-time and predictive analytics. But at the heart of being more agile and providing BI are tools you may already have in place, things like Microsoft Excel. Today, Excel is kind of like a Swiss Army knife for business intelligence. It's an amazing tool for surfacing and using almost any type of data from any source. Let me jump into a quick demo that is based on the real use of Excel at a major U.S. medical center. Everything I'm going to walk through demonstrates features that are native to the latest version of Excel. The demo itself utilizes 200,000 rows of data extracted from an Epic EMR and other systems used to manage clinical and operational performance. Obviously, we've anonymized the data and shifted the actual location of the medical center where this application is in use. So today we're at Contoso Healthcare. I'm the orthopedic surgery service line manager, and my chief executive officer has just asked me to come to the board of directors meeting next week and give a 20-minute report on how we're doing. Orthopedics has been a center of excellence. It's something we've invested in, and leadership want to know how we're doing. So the first thing I'm going to do as a manager is go out to the SharePoint site and go into the Health Analytics portal, where what I see is a roll-up of all the key performance indicators across the hospital. What I really need, though, is information specific to my service line. So I'm going to go into something known as slicers, a standard part of Excel, and I'm going to select orthopedic surgery. Now, this may take a second because what it's doing is going through roughly 200,000 rows of real hospital data that's been anonymized. I have been asked to report on performance for the past quarter, so I'm going to go down to something known as a timeline slicer, and I'm going to select information from the past quarter. So once again, this is a great example of self-service. I'm not going to any analyst. I'm merely going out to a secure site to perform my own research on demand. So once I've done this, I can go back to that opening page, and now what I see is all the information is specific to what I requested, which is orthopedic surgery performance data over the past quarter. The first thing I'm likely going to report on next week will be finances. So I'm going to go up and simply highlight some of the costs for the service line. As soon as I do, you see this little quick analysis button. I can select that and have this data visualized in any of a number of ways. I'm going to select charts. I'm going to select pie chart. I'm immediately presented with something I can now copy and paste directly into my PowerPoint presentation. The next thing I want to look at is where our patients are coming from. So I'm going to go down to this tab, select Admissions Map. This is a great example of a feature in Excel known as Power View. It's taking the data that I've requested, in this case it's the referral data, and plotting it on a map to give me a very clear indication of where my patients are coming from. Once again, I'm going to take this, I'm going to copy and paste it directly into my PowerPoint presentation. The next thing I want to do is look at some quality indicators. So I'm going to go out and look at things like average length of stay. I'm going to look at a quality measure known as order set utilization and compliance. In this case, I'm seeing all the service lines at Contoso Health, and what I see is orthopedic surgery is doing well both in terms of average length of stay and compliance against our order sets by physician. Now, always looking to do better, I may want to look at how we can improve on order set utilization. So I'm going to go down to this tab, select order set utilization. I'm now presented with order set utilization and compliance across all the procedures that comprise our service line for orthopedic surgery. What I see is a variance on order set utilization by procedure. If I want to make that more visual, I will simply highlight that, go up to conditional formatting, select color scales, and now I have a way of visualizing where we're doing well and where more emphasis may be needed. Finally, if I really want to get down to a granular level, I can select any of these procedures, and I'm presented with information down to the physician level for what I requested, which once again is orthopedic surgery procedures performed over the last quarter. What I see is my highest volume surgeons are doing very well in order sets. I have some others that aren't doing so well, including Dr. Meadows. Once again, by pointing and clicking, I can now go and look at each individual procedure of any physician to see how we're doing and, frankly, where we can make improvements. Excel is a very powerful tool for surfacing, visualizing, and using data on a self-service and a research-on-demand basis. It's available throughout most organizations today, and it's just an incredible tool for powering business intelligence and health analytics in any healthcare organization. If you're interested in learning more, I would encourage you to check out Microsoft.com/health or email me at tomlaurie@microsoft.com. Thank you, and we look forward to hearing from you.